Everyone, welcome back to this channel again. And welcome to the first episode of the Topper Talks. So you can see that today we have a special guest, and let me introduce him first. He is Dr. ARITRA MANNA, and he secured a wonderful rank, All India rank 472 in the NEET PG 2024. He did his MBBS from BSMCH, so literally he is my college senior. So, Dara, first of all, we are very much thankful to you for coming here and giving your consent and also your time for your daily schedule. So, let us know that how are you? কেমন আছো বলো?
আমি তো ভালোই আছি, তুই কেমন আছিস বল?
এই দাদা চলছে, এক্সাম আসছে আমাদের আর কি। And just say an hi to our viewers.
আচ্ছা, firstly I want to thank Aritra for inviting me here, and hi to everyone who are watching us.
Dara, today we have a few questions that I collected from my juniors, my seniors, my batchmates, and also from myself too. So I will ask you one by one, and you have to answer them from your experience, and especially those are from the NEET PG preparation, your experience, and also from your MBBS days. So may I proceed?
Okay, yes, of course, and I will love to answer those questions. And if my answers may help someone a little bit, and I will be very much grateful. Okay, so you can ask me.
Uh, so the first thing is that how much marks you used to score in while MBBS? I mean that during the props mainly. And also, then how many honors did you get in your MBBS life?
Actually, first I want to tell you that actually the marks does not matter in professional exam. I did not exactly remember actual what percentage I got in my MBBS. Overall it was about 72 percentage in four years. If I calculate, it was around 72 percentage. And honors, I got honors in first year in physiology, in the second year pathology and pharmacology. Third year I did not get any honors, and after in final year I got honors in surgery. So this was all about it, and there was especially no gold medal exam in our college. That's why I could not attend those exams. I had a I wanted to give those exam, but I could not do that because it was not conducted at all. That's why.
Okay, so total four honors in your MBBS days. So Dara, next question is you know that total nine subjects are there in final year, and you know you may hear that now it is an 11, especially from our batch. ENT and Optha is also added in the final year. So we just want to ask that did you start the reading those final year subject while you are in second year or third year? Because many students wanted to complete the especially the small subject or the some portion of the medicine and surgeries in the third year too. So did you have you done this such type of studies in third year?
Actually, I started my preparation for NEET PG in second year only. In second year, I joined DAMS face to face, not face to face, the DAMS satellite course. So in DAMS satellite course, I used to go there and attend those live classes. In second year, I completed the second year subject itself. There in that time there was four subjects. FMT also there in second year.
Hmm.
So second year four subject, and first year anat physio and biochem. Total seven subjects I completed in second year. So when I reached in my third year part one, then I started my final year subjects also. Slowly, I mean, I completed first the third year subjects IENT, PSM. In third year, those subjects are small in compared to final year subjects. So I completed them first. Then I started preparing the final year subjects, especially the big subject of final year like medicine and surgery. I started preparing those subjects first, and I almost completed those subjects in my part one itself. And in my final year, the pediatric, gynae, and other short subjects of final year, I completed in my final prop exam. Okay, and my source, especially my source was from DAMS, and only two or three subjects I completed from Mero. Okay, so in this how I started my preparation, and I completed those 19 subjects. And when I reached in my internship, almost 19 subjects were completed. Only two to three short subjects are left, and those subjects I completed in my internship. So this is all.
Okay. So the one thing that, as you said, you completed the many of the subjects, also the main subjects of the final year in the third year and also the second year. So already, I think you have answered. Still, I want to ask that according to you, one should start preparing for the NEET PG during which MBBS years? Like for an average student, not for the toppers. Like as an average student, one should start at which year?
Because I want to tell you one thing that this year the NEET PG exam has been a devastating experience. It's so much tough, and it is getting tougher day by day. Very much competition is there. So much candidates are increasing. Seats are limited for general candidates. So the competition is really tough, and you have to start early. If you can start early, you will be in a better position. So the best year to start for NEET PG preparation is second year, because in first year it takes time to get adapted with those MBBS subjects like anatomy, physiology, biochemistry. So in first year you don't start your preparation for NEET PG. Just just go with the flow in first year and get a hold on your first year subject. And second year is the best time to start your preparation. Because in second year the patho, pharma and micro, these three are the base subjects. Your final year subjects are based on these subjects only. So you have to get a strong hold on this subject, and and you can't thoroughly read your textbook also. It is better that you start your preparation for in any platform you want, dams, Mado or Prevladder. Complete those subjects from this platform, and get the basics clear, get your concept clear, and after your concept is clear, then you can go with your textbook. The important topics you can read from the textbook. Okay, so
Okay. Uh, so now the next question is that is the like we also the MBBS students are to little bit accustomed to it, studying. So am I audible now?
mm-hmm.
So maybe students are a little bit accustomed with solving the PYQs of the props. So I just want to ask that the previous year topics, and I will not ask about the previous year's questions. Previous year's topics for the props are also important for the previous year's topics for the NEET PG, or it is totally different.
Obviously, the important things are always important, be it in professional exam or in NEET PG exam. Important things are always important, but the way of asking question that is totally different. In prof
Exactly.
exam, it tells you tells you to describe the thing elaborately. If you don't know the exact thing, you can write it in one or two pages. But in NEET PG exam, you want to pinpoint the things that are important for your exam. So the two things are totally different. In EPG, preparation is a totally different ballgame. So you have to work there smartly. Hard work is important, but smart work is very much important for EPG. You can read the topic as a whole, because if you open your textbook, that one chapter is 10 to 20 pages written there, but in NEET PG you don't need all those topics, all those topics, all the things you don't need. You just need the main things that are asked previous year questions that are also important for NEET PG, but the previous year questions of the NEET PG only, not your professional exam. Topics are important, but the way of asking is totally different in each page.
Okay, got it. So now the next thing is like, is it possible to prepare for the NEET PG while doing the internship? Because I just want to ask from the perspective of the BSMC, because you know that there is a lot of work pressure, or especially for the interns in the BSMC. So is it possible whilst doing internship studying for the PG?
One thing I want to advise to all the interns there, that you enjoy your internship. This is the first and foremost thing. You have to enjoy your internship. This is the only time of your MBBS life that you will get touch of all the 19 subjects. All the postings you enjoy there, learn the clinical skill, learn how to do the procedures. That is the utmost important. Okay, and NEET PG থেকেও ইম্পর্টেন্ট আর কি, বুঝতে পারছিস তো? And so if you complete your all the 19 subjects in your second year, third year, final year, And okay, you try to make notes of this subject in these 3 years. Try to get a hold of this subject, and in your internship, try to get in touch with those subjects only. Okay, I am not telling you to read those notes only and not going to duty. Don't do that. Okay, you have to do your duty. You have to do your procedures, and also you have to get in touch with those notes. And I am not telling you that it is not possible. There are some students, for them it is possible to prepare with those hectic duties and managing study. It is not possible. But I was not that kind of student. I was a very ordinary student. I did my internship wholeheartedly. I did my internship wholeheartedly. I have done my all the postings wholeheartedly. I had to learn all those skills from those postings, and also I was in touch with my notes. So there are some students, those who can manage their studies as well as their duties during their internship time. It is possible for some students, but it was not possible for me. I could not study wholeheartedly during my internship, but I did my internship wholeheartedly. I enjoyed the most out of it. Okay, so if you that kind of student who can manage all these things, you can go for that. You can do your study during your internship also. But one thing I am telling you that please get in touch with your notes, with your studies. Don't get detached from it, because if you get detached from your studies during this whole internship period, and starting it from the beginning, it will be difficult after internship. So try to get in touch with your studies, uh, and read side by side with your duties. Okay.
Achha. So the next question is that did you choose the house staffship after MBBS, or one should choose or not? Your opinion, just.
Yes, I chose house staffship in Department of Nephrology. I did house staffship for 6 months only. Then I quit my job, and I devoted myself fully for NEET PG preparation. Okay. Yes, one can obviously join house study, because after internship, your monetary aspect is gone, and you have to study as well as you have to do your duties also. But I want one thing I want to advise, that you try to choose your house study based on your duty. If there is any hectic posting during your house study, it will affect your preparation. So better that you avoid those postings. Try to do house study in a less posting, less duties in that aspect.
Is so it is possible with the for
Of
the
course possible.
preparation
Yes,
for
of
the,
course possible.
yeah.
Yes, of course possible. Doing house study as well as preparing for NEET PG, yes, it is of course possible. But it is better to avoid hectic duties. If you have if you have opportunities to get house study in such kind of department where duties are less, that will be better for you.
Okay. So so next question is that what you suggest to study from the ready-made notes like Marrow, Dams, or self-written notes or self-made notes? Which one will be better for someone?
There are two type of scenarios. One, students who have started their preparation early. Okay, so who have started their preparation from second year or third year onwards, they can do their handwritten notes. Handwritten notes are always best, because the notes that you are writing, it gets transcribed to your memory, and that gets imprinted on your memory. Okay, and it creates a visual memory also, because you have made it on your own. And if you have not enough
Exactly.
time in your and if you have not enough time in your hand, like if you are in internship or if you are post intern and starting your preparation, then handwritten notes is not possible. You have to believe on your ready-made.
Okay. So, and next question is from where you used to solve the MCQs, like from apps, or there are some review books are there for each and every subject. So, which one
There are
will be more preferable?
Acha. I did not study any review books at all. My In MCQs, I only did MCQs from Marrow only. Marrow was the platform where I used to solve MCQs in custom module mode, and for video only, I solely dependent on dance. I told you earlier. I I did my subjects, complete my subjects from the dance only. Two or three subjects I completed from Arrow, and and question bank and MCQ practice and grand test, everything I used to give from Marrow only.
Can you suggest that which can you tell us that which subject you completed from the marrow?
The Marrow, from Marrow, I completed surgery and gynae. These two subjects I completed from Marrow.
And from and medicine pediatrics
In Pedi, all subjects I completed from dance only.
only.
I was a dance student in my second year onwards. Second year, third year, final year, these 3 years I was purely dance student.
Okay. So, how one can balance the MCQ practice and reading the theories? Those after the I'm talking the phase when one is solely involved into the NEET PG preparation, not from the or not doing any house stuff or internship or MBBS days. How one can balance the doing practicing the MCQs and theories, like which portion or which time duration one should invest.
So I, uh, I told it in my YouTube video also. Those who have already who are just started their preparation after MBBS, or who are post intern, who have just started their preparation, and who are reading for the first time. So in that time, your main purpose will be reading your notes and completing those subjects. That is the main thing that you have to focus on. And with those subjects also, you have to start solving your MCQs. And for MCQs, you can solve custom module. This is the best way to solve any MCQs. It is not possible to. It is humanly not possible to complete all those question bank module from any platform. So best way is custom module. Suppose you are reading anatomy, you have done with the subject anatomy. So in anatomy, there are many portions. Suppose you have completed neuroanatomy and head anatomy. These two portions you have completed. So try to make a custom module of those topics only. 40 questions for each custom module, and try to solve those questions. And try to give those important hashtag like recent NEET, NICT, clinical, and image based. These tags you use and solve your custom module each day. To try to do at least 40 to 50 question each day. If you can do it consistently every day, then your MCQ solving skill will improve certainly. Obviously, this will improve. And as you approach towards your exam, or you have already done with your first reading and you have just started your revision, at that time, you can do two custom module each day, 40 or 50 question each. One during your afternoon session, and one at the night session. Suppose you are reading anatomy and revising anatomy. So if you are reading anatomy, then make a custom module of anatomy 40 questions, and one subject those you have already read. Write your revision that one subject that you have already completed, like pharmacology. You have completed pharmacology previously. Before anatomy, you have completed pharmacology. So try to create a custom module of pharmacology also. So one custom module for the ongoing subject and one custom module for the previously read subject. In this way, you can solve 80 to 100 questions during your revision time. So if I tell the summary, when you are reading for the first time, try to solve at least 40 to 50 questions each day, and when you are revising, then you try to solve 80 to 100 questions every day. That is more than enough. No need to do anything.
Okay. So when one should start giving the grand test like GTs or on the MROs or like after just like about how many days before the exam one should start giving the GTs?
Someone is wholeheartedly starting their preparation for NEET PG, then they have to first see what is their base level. So I gave my grand test for the first time when after my internship. I wanted to see my base level, where I stand among my peers. So after that, you start giving grand test in every month, not more than that. And as the exam approaches, and then you can give one grand test in every 10 to 15 days. And just before the exam, 15 to 20 days, don't give any grand test. I request everyone, don't give any grand test just before 15 to 20 days. Because if your score somehow deteriorate, it will bring down your mood. Okay, that will not be good for you.
Okay. So I think we are almost done with the question. So last question is that what tips you want to give, especially for three categories of the student. The first one is those are in the final year or final year of MBBS. Those are doing internship and those are in the post MBBS phase. So now let's start with the those are appearing for the final year. Like just like my batch actually, they are starting. They are about to start their final year in the April. So, what tips you want to give for the PG preparation?
So final year student, just starting their final year student, right? So for those students who have not done, who have not started their preparation yet, but going to in the final year, my advice will be just you have to get a hold on your final year subject. Okay, in your final year now there are 9 subjects, I think, in this
No,
year.
but both ENT and Optha is also included, so it is now 11, I guess.
11 subjects. So you have to focus on your these 11 subjects. It is not the time to complete your first and second year subjects. So try to focus on these 11 subjects. Try to complete as much as possible in this in your final year. Okay. So after your final year is over, when you start your internship, so in your internship days when the minor posting goes on, then you try to complete those subjects that you could not complete in your final year. Okay. In this way, so within your internship, try to complete all those 19 subjects if possible. Try to complete all those 19 subjects. If it is better if you have made your handwritten notes, but if you have not done it, your handwritten notes, then the ready-made note will also suffice. Okay, and this is
Sorry
for
to interrupt you. You said that while doing the minor posting, try to complete those are not completed in the final year.
final year.
See, while for the giving the final prop, we have to complete all the final year subjects, or you are talking about the first year or second year subjects.
Final year subjects also the preparation of those you have to get a hold on your final year subjects. 11 subjects are there, you have to get a hold on your 11 subjects. Okay, suppose you could not complete one or two subjects from arrow, prebladder or dams anywhere. Okay, those subjects you have to complete in your internship also, and also yes, I forgot the first and second year subjects also. You try to complete your internship in your minor posting. Okay, in this way you try to complete all those subjects all those 19 subjects in your internship also. Internship, try to complete as much as possible. Try to do that. So after your internship, then start your actual preparation for NEET PG. You have already completed your 19 subjects. That will be easier for you to go through those notes again and again, because revision is the key. You have to revise them multiple times, and you have already read them one time. So it will be easier for you to go through those subject and topics. Okay. So this is for the final year, and those who are in the second year or third year, and I will tell them that you try to complete this year subject, the subject, the year that you are in. You try, this is the time when you have ample amount of time. Okay, you try to complete your subject second year, third year and final year. Try to complete all those 19 subjects in these 3 years. In internship, if there is any subject left in internship, you can complete them, and your final preparation will start after internship. Okay, and those who are who are after MBBS post intern and just starting their preparation, for those I want to tell that this is the time you have to complete all those 19 subjects, and আবার দেখা যাচ্ছে না.
You can continue.
For intern, for post intern who are in the who have completed their internship and starting their preparation, they have to complete all those 19 subjects in after internship. Okay, and then they have to try their revision, and it is possible that in this time yeah, there is not enough of time to complete all those 19 subjects from your main notes. You can go through your revision notes also. If your base are stronger, then you can rely on your revision notes also and complete those subjects that you have not completed till now. Okay.
As you said that for the who are doing internship, so they have to complete the left subjected in their minor posting, right?
Yes, yes.
So that's what I think we have already done of all of our questions. So thank you so much for Dada for answering all those questions. And also my viewers, I just want to say that my Dada's YouTube link I have given in the description box. You can go and check it. Dada may also try to guide all of us through this video. So make sure that you have also checked his videos too. See you in the next video, and thank you, Dada, for coming here again.
Thank you, thank you, thank you all.
So bye,